How to achieve successful case presentations, make it easy for patients to say yes. I've been practicing about 25 years. And if I can get just one point across to anybody who's watching it, that would be great. Because I learn something every day. I mean, I literally learn everything. You know, I've made mistakes. We all have, you know, and we learn from them. And when I first got out of dental school, I did the old handshake for a partnership. Boy, did I learn my lesson on that one. At the time where all of a sudden I'm going to be a partner, he's like, well, you kind of owe us some money. I'm like, wait a second, we did the handshake here. You know, so I didn't even have to get to sign a contract. So it was kind of, you learn as you go along. And hopefully you'll get something out of this. So basically, what is a patient? Well, patient can be a scared person or a child, or a person who is a child. It could be a person who wants all the ingredients. They want to know everything that is involved in doing their procedure. They could be very regimented, and failure is not an option. And they tell you that right up front. I want success here. They could be basically looking at their clock all the time, because it's time. They have to be out by a certain time, or they want this done, or you know, they're constantly looking at their watch. They could be happy-go-lucky. Do whatever you want. Have fun. And they don't care about anything. They just want you to do the treatment and get it done. Or they could basically be a kind of person who was very regimented, very structured, wants to know everything in detail, wants to see the treatment plan, every aspect of it, and then have questions about every aspect of it. So, what is a patient thinking when they come into your office? They're nervous, right? Anytime you go to a doctor, you're always nervous. You don't know what's going to happen. You don't know what's going on. You don't know what's going on with you. They're very anxious. They have anxiety, and anxiety builds up over time. And the more they think about it, the more anxiety they get. They had bad past experiences. A lot of patients come in saying, "Oh my God, you know, in the military, I hear, you know, sometimes they're on the chest taking teeth out, you know, and I've had so many patients come in with such bad experiences, and so you have to kind of overcome that." Money before entering the office. They're always thinking about their budget, their pocketbook, you know. Oh my God, how much is this going to cost? They're thinking about their day ahead. Do they have their own presentation later? Do they have kids they have to go to? Do you have to bring someone to soccer, or you know, one of the kids to a ball game? So what do we want to achieve? We want to have a comfortable patient. We want to have patient education, because that's very important, that they understand what's going on. You want them to accept your treatment plan. And the most important thing, why treatment needs to be done. So if they basically understand what you want, and they say, okay, you know, this, you need a root canal. They have to understand why it needs to be done. And that's the most important thing that a lot of people forget. They have to understand why. Now, if they do all that, you get a happy patient. So my question to you is, what do you think you need to have a happy patient? So I like this quote: patients do not accept recommendations for implants, crowns, and root canals because they understand the fine points of what is involved. Okay? So if I asked you one word that basically explains what patients need in order to do treatment, what do you think it is, Paul? Looking at this picture, what word comes to mind? What does that patient need from that doctor to do this?
Trust.
Very good.
Thanks.
You're the one who's ever got that. Very good. Excellent. So how do you achieve trust? Most important thing is eye contact. The eyes are the windows of the soul. So when you look at somebody's eyes, you know that you have them. And if they look somewhere else, you know they're not following you, or they're bored, or something's going on. You got to take time to listen to their main concern and repeat and necessary in a question. That's really important because you want them to kind of understand that you care about them. So if someone comes in and says, you know, hey, my tooth hurt me because I had a cold drink. So you kind of put into a question. Oh, so last night you had a cold drink and it really hurt you, huh? You know, something like that. Self-confidence. Be confident in your answers, no hesitation. That's really important because if you're not confident, you've already lost a patient. So just say what you have to say and leave it. Give good explanations. We're going to talk about that later. Treat all patients the same. How many patients have come in with ripped pants or the worst kind of cards, and they've done the best, you know, the most treatment that you can imagine? All right, I've had $10,000 cases like that. Or you have somebody who has all these great diamond rings and this Mercedes, and they're the ones that fight you all the time. You never know. So you treat everybody the same. You make clinical decisions, non-economic decisions. Money will come, but if you start making decisions on economic reasons, it's not going to work. It's going to backfire. Recommend what is best for the patients and let them decide that's what they want. So basically, you know, it's up to them to decide it, but it's up to you to explain to them why it needs to be done. Refer or ask when unsure. Don't try to be a hero. A lot of times I had to bail out associates who basically, you know, tried to take out a tooth and it was in the sinus, you know, or it was touching the nerve and we had to send it out, or just don't bite it till you hear. If you can't do it, send it to a specialist. That's what they're there for. They're there to help us. You know, we're all partners in this. Or ask somebody how do I do it? Never lie or try to cover up something over the patient. They'll respect you more. So if you separate a file, and I do mean separate, not break, it happens. It happens to everyone. I had one person who was crying when I was trying to train him, and I came over. She said, "Why are you crying? There's no reason for that. You know, it happens. Just tell the patient. You don't want them to go down the street and to another dentist, and all of a sudden it's like, well, you got a separated file in your tooth there, and then they come back, and that would be malpractice. So basically, it's not malpractice if you separate a file in a tooth. It's now malpractice if you leave a root tip. How to get patients involved. Enter all videos is a great way of going. Flip charts, video, computer presentations. Make sure you show disease progression. That way they understand exactly what's happening. And you can show them from their mouth, and then maybe take a clipboard. I'll show you some examples later and kind of show them how their mouth relates to what you're showing them. It always leaves a lasting impression and keeps the patients wondering about the decision they're about to make. For example, infection throughout the mouth. Why is infection so important? Because you're losing bone. And if you lose bone, then it can end up in systemic implications. Okay. Make patients co-diagnosticians. So basically what you want to do is, let's say you're talking to them about periodontal disease. Let them understand that 1 to 3 is basically minimal. You know, 4 to 6 is infection. 7 to 9 is a bigger infection. And so they understand. And now they're kind of they're understanding what you're talking about. If you're talking about a cracked tooth, well, as you're going through the exam, let them know, you know what, this tooth is cracked. We're going to come back to that. You know, just keep that in mind. And they're now thinking about it. Now they're thinking about it. And they're saying, well, wait a second here, cracked tooth, what does that mean? And transform your patient from a passive to an active participant. If they're passive and they're just sitting there and they're just soaking in all this stuff, when I used to teach 3rd grade, 8th grade, 12th grade. I taught at Hofstra. I taught at NYU, or medicine or pathology. If you just keep talking, then basically they're going to turn you off. But if you make them to an active participant any way you can, you're actually going back and forth. And it's so easy to do. Okay. Does everybody know about the KISS principle? Keep it simple, stupid. I'm sure you've heard of that, right?
I definitely have, Dr. Rosen.
Okay, that is the easiest way to do it. The KISS principle basically allows you to keep things simple. Don't expand on things, because when you keep talking, it's not going to work. And I'm going to talk about that right now. Okay. So let's go tips on the presentation. We talked about eye contact, how imperative it is, right? Windows of the soul. So when you're looking, you actually look at the person. Okay. Don't look down on the floor. Don't look at the x-rays. Don't look at the wall. Don't look at your assistant. Look at them, because you have them. And they know you have them, because you're trying to help them. Make sure the patient understands what you're trying to say. Use simple terms, easy terms. Don't try to be complicated with them. It makes it much easier if they understand what you're talking about. For example, barnacles, splinters when you're talking about calculus, a barnacle on a ship. You're talking about bone loss, or you're talking about, let's say, take to a hole. Think about a pole in the ground. You have to basically fill it in, otherwise that pole is going to fall. Little things like that. Keep it short. Remember the KISS principle. Don't create confusion. The more you talk, the more you're going to basically create confusion in their minds. Tell them what they need, why they need it, and how they're going to do it. Take breaks. So basically, they're extremely helpful in analyzing what patient's thinking. It's a great time for an individual to interrupt and ask a question. So I would stop and say, hey, do you understand everything we're talking about? Do you have any questions at this point? It lets them know that we care about what they have to say, because this way they're becoming an active participant. Do not go on for the patient's grasp to hear and understands the basic problem they presented with. So if you're talking about periodontal disease and showing them whatever flip chart or x-ray or whatever you're talking about, stop. Make sure they understand that before you go on to what an onlay or a crown or a root canal or any of that is, because they're already going to be confused. So keep it really simple. Focus on the worst first and treatment plan the rest. Encourage patients to take numerous small steps with their treatment rather than getting everything done at once. Sometimes it's not worth giving them a $10,000 treatment plan. Divide it into stages, divide it into steps. So the first step may be, like we talked about, periodontal, so you deal with the scaling and root planing. Or maybe we'll do quadrant dentistry. So you can do one quadrant and then maybe a crown in that quadrant. But if you give them everything at once, they just get so overwhelmed and they see the bottom line. Now, some people do that and it's successful, but with me, I just break it down. So that way they do each step. And if they don't do everything at the first visit, that's fine. Once you get that trust, they'll come back when they're hurting, when they need to be done, when it needs to be done. Avoid overload. The more you explain, the more the patients think you're trying to convince yourself. And it's true. The more you talk, the more they're going to think that you don't understand what you know what you're doing. You're not confident. But if you say, you know what? You need a crown. Not, I think you need a crown. You need a crown on tooth number 4. It's cracked. We kind of discussed the crack a little bit. You can show them what a crack is and how a crack can progress. Then they're ready to do the crown. But if you say, you know what? I think you need a crown. Well, maybe not. Maybe we could do a filling on that. No, you know what? Maybe an onlay. Yeah, an onlay. That's what we should do. Yeah, I thought about it a little bit more. Okay. I've lost the confidence in the patient. What to look for during a presentation? A blank stare. If a person is looking like they're just totally concrete on their face, okay, you've lost them. Stop. Go back. Talk about something, anything to get them back into your frame. Even talk about something personal, like you can talk about maybe about the weather, anything, just to get them back into it. If they see they're looking at their watch or elsewhere, like the businessman I showed you, then you got to kind of stop. At this point, I would stop and I would probably get my benefits coordinator, and I would not go any further, because if they're looking at their watch, you've already kind of either bugged them, or you just like, they know that they have to get out of here at a certain time. You may say, hey, do you have to get up by a certain time? I love this quote. Always ask good questions during the presentation and listen carefully to the answers. So if you always ask good questions, you'll have good answers. Okay, closure. Don't pressure people into treatment. Remember, closing isn't pressuring people into treatment they do not need. Rather, it's helping patients to overcome their fear and anxiety that we talked about before and make decisions that are in their best interests. So basically, they already have a lot of pressure, to say no. But if you keep pressuring them into that, they're going to say no. Let them make the decision based on where do we go from here? Do you have any questions? How does that sound? Are there any concerns I have not addressed? I'd be glad to start on that today. Now, if the patient hasn't agreed to the same-day treatment, remember we talked about if they trust you, they're going to come back. So the last thing you say, simply state, is what could occur if the treatment plan is not started? And in that case, I always use RBA. It's risks, benefits, and alternatives. I also did some defending of dentists, and risks, benefits, and alternatives, if you put that in your chart, it really does a lot if you go to court. So risk, benefits, and alternatives is extremely important. I would put it on every note.
Dr. Rosen, tell us a little more about that, because it's a really good point. I write in the chart, reviewed with patient what happens, the consequences of no treatment, pain, swelling, infection. I believe in this too. Do you just write RBA, or do you write a little more after that?
I write risks. I just write RBA. And then
And
sometimes, risk, benefits, alternatives discussed with the patient. And then sometimes I may write, discuss a certain type of treatment. Patient does not want to do it this time.
Gotcha. Good point.
Okay. Thank you. Okay. Just wanted to remind you that without treatment, that tooth might need a root canal and extraction in the near future. It was a pleasure meeting you. So now you're not pushing them. You're not a salesman. Okay. You're not like a car salesman, basically. You've met them. You've told them why things need to be done. If they don't agree at that point, don't push it. And just let your financial counselor or your treatment counselor deal with that aspect of it. But you say, hey, it was a pleasure meeting you. Now I give out bios, so they know what my goal is of the office, and they can read about me a little bit and my team. And I give that to every patient who comes in, because that way I've gone to restaurants and I see them in the restaurants. I go to gas stations, I see the bios there, and then other people see it. But if it was a pleasure meeting you, hey, you know what? That's a nice thing to say. That means that you really care about them. You don't just care about the money. You don't just care about pushing them into treatment. You really care, and they'll leave. My father used to do this when he walks into Best Buy, and we know we want this TV, but he'll be like, you know what? No. I'll he starts walking out. Well, a lot of times the person knows, and if they're very nice to him, he'll come back. It'll be like, hey, let me just tell you something else, that kind of thing. Okay. Patients cannot value what they don't understand. People won't buy what they don't value. I think that's a really great quote, because basically that explains everything we do. If they don't trust you, they won't value anything. If they don't understand why treatments need to be done, they won't value it. If they don't understand the treatment itself, they won't value it. So you've got to create value. And sometimes you create value not by scaring the patient, but by being honest with them and showing concern and showing, basically urgency that if you don't get this done, then something can happen. So how do we do that? We do that through synergy. Okay? So we do that through synergy. And basically, what is synergy? Synergy is the increased effectiveness that results when two or more people work together. So, for example, your front staff, if they don't smile, that's part of that synergy. So you're working together with your front staff. You're working together with your assistant. You're working together with your hygienist. It's all synergy. And if you all are on the same page, the patients basically will do what you ask them to do. So the role of each person in a dental team can positively or negatively influence a patient's perspective of practice. If you have a great experience when you walk in, if you have a great experience when you answer that phone, for example, ask them how they are, or whatever speech you use, I guess, in your office. It's really important, because that way the patient has a positive influence from the time they actually make the appointment to the time they come in, to the time they sit down, to the time they leave. Okay, handoffs. We talked about handoffs. Some people like handoffs, some people don't. So I try to use them, so I'm just going to say how I do it. So when you do a handoff, you hand off to either a hygienist, you hand off to your treatment counselor, or you hand off to your assistant, or the assistant hands off to you. It's almost like a football game. In a football game, a quarterback hands off plays to the team. Well, the coach hands off the plays to the quarterback, right? And if you don't have that, then basically there's no flow. So when you're doing it, you mention the person you're handing off to. Hi, this is Liz, my treatment counselor. She's going to help you get this treatment done today. Liz, this patient's concern is either financial, or they don't have the time, or they're buying a new house, or whatever the case may be. So that way it's a flow. You mentioned a brief history of what you found. Remember, you are not making a diagnosis here. All you're doing is just doing very simple, keeping it simple, and what you found and what the patient needs and why it needs to be done. That's all. And they deal with the finances. You mentioned any teeth you saw might need some sort of treatment. It goes for recall of full exams. So basically now you've mentioned to them the tooth that you're concerned about. You mentioned to them the fact of why it's, what's going on, what's the patient's concern, what's your concern, and that you can get it done today. And so that way it won't get worse. Now, there's a lot of ways of doing this, but basically handoffs kind of work in that way. We talked about terminology, keeping it simple. So this is kind of some terminology. Make sure the entire staff is on the same page. For example, we use infection. Infection. It's just like having infection that you have to treat with antibiotics, right? So if you have an infection, it's going to get worse. So we do gum therapy or periodontal therapy. We do a type of gum therapy which consists of scaling and root planing, or gingivitis cleaning, or prophy, or surgery, or whatever it is. It's a technique, and it's a technique. A lot of people say cleaning, and some people, and when you say cleaning, you talked about people who basically come in, they want their free cleaning. So what do they think about? They think about their free cleaning, their prophy, right? Insurance covers it. But if you talk about a technique that has to be done for them under the theory of gum therapy or periodontal therapy, and there's an infection there, then you're all on the same page, and they understand the terminology of what they need to be done. So you also have a way of showing patients pictures of what scaling and replaning is. The same goes for any procedure you use. The more media you use to show patients, the easier it is for them to understand. Because if you say scaling and replaning, a lot of people never heard scaling and replaning. They just think deep cleaning. And when they think deep cleaning, sometimes they'll think deep pockets. And when they think deep pockets, they'll think of their wallet. But if you just scaling and replaning and show them exactly what it is and what it does, you've already basically, they understand. RBA discussed, very, very important. Risk benefits and alternatives. And when it comes to Arrestin, try to show them what it does. Now we use Arrestin, perio chip is other methods, and I use Arrestin. I've had a lot of success with it. So, Paul, what do you think is the main cause for patients not accepting Arrestin or perio chip or any of those other types of things that we could put in the gums to help?
Concerned about cost?
Yeah, that's what most people would say, and that's a great answer. Believe it or not, this study showed that it's not cost. Our pharma did a study, and they found there was trust. If you don't have trust, that's it. They won't accept the treatment. If they don't understand the consequences of not undergoing the treatment, they won't do the treatment. If they understand the diagnosis of what's going on, that is part of gum therapy, and that when an infection is going to get worse, they'll do it. But look what cost is. It's number 5. So cost of the recommended treatment and comfort of the treatment procedure, and then length of time for the treatment. So cost is all the way down the list. It's trust, and gaining trust by kind of the methods that we talked about before really does help. So contrary to what you might expect, cost was not top factor. In the same survey, patients diagnosed with periodontal disease were willing to pay $633 to avoid losing a tooth. And remember the systemic part of this too. So it's not only losing a tooth. If they have a history of heart attacks, stroke, Alzheimer's, dementia, pancreatic cancer, and now COVID-19, right? COVID-19 is directly related now to periodontal disease. And they've actually had a lot of studies now, especially in Israel, saying that people in the ICU, quite a few of them ended with periodontal disease. So that kind of helps a little bit. A few more helpful examples. This is something I love. I love this, this basically from our pharma. And it shows a liquid rinse can only go so far. A toothbrush or dental floss can go that far. Scaling and root planing can go that far. So what are you using? You're Reston or some sort of antibiotic to get the infection. Because a lot of people come in and say, hey, you know what? I brush really well. I floss. Well, that only goes so far. You have to get down to the bottom of that pocket, right? You have to get down to where the infection actually is. So that helps a lot. And then I show this. This is from a program that I use all the time. It's called, I don't work for the company or anything, but it's called Dental DDS, basically. I have a mind block there. I'll get to in a second. But if you look, if it shows you arrest in here, you're putting the arrest in. DDSGP. As you get older, you'll see what happens with your memory. So DGSGP is a great program that I use. And this is one of the aspects you can show patients. So it shows you before and after. And it has every aspect of dentistry in it, either videos, animations, pictures. You can get it on the App Store. I believe you can get it on Google. It could be on your iPad. And I bring it up with my patients and I show them all the time. This is a progression I show them. So it's something basically that shows them where the perioprobe is, what's happening with their gums, and what's happening to bone at the same time. So now they look at this perspective, and I show them their own x-rays compared to what I look here, and you can see the exact same thing. So now they actually see, well, wait a second here. My bone does look like that. Wow, my gum tissue does look like that. And that's what those little measurements mean. Now they're an active participant. And I have this in every room. I love this. This basically shows how systemic disease is related to periodontal disease. I mean, you look at that and you're like, wow, even pregnancy, everything is related in that poster. Okay, let's talk about grinding. A lot of people grind these days, right? And we talk about Invisalign. We talk about all sorts of crowns, bridges, root canals. But what happens is if a person's grinding, they create wear. And as they create wear, they lose their bite, right? So as they lose their bite, they start causing abfraction lesions. So as you can see, you get abfraction lesions because the forces have to go somewhere, so they go to the sides of the tooth. And you can show them that. And you can show them a picture like this and show them basically in their mouth. Or a lot of people can wear tori. When a woman wears a high-heeled shoes, they have to sometimes do bunion surgery, right? They get bunions. So instead of the forces going to the sides and creating bunions, the forces go to the sides and creates tori. And they get larger and larger and larger. And that's basically from grinding. Because the forces have to go somewhere and they're either created or destroyed in the mouth. And they go toward tori. And then you have over here, this is another thing from DGSGP. This is basically the TMJ. And I show them, you know, now you get headaches. Why? Because I show them an animation of how you get this little click. And so when you get this little click, the forces have to go somewhere. So they go to the muscles and they go up here and you get a headache. And all again from grinding. So TMJ, grinding. And then you can go from this into Invisalign. So what can you do? A lot of people will come in, right? You want to do all these fillings. Well, if you have a lot of occlusal fillings and you know the person's grinding, a great little trip to use, especially if they don't pay much for the fillings these days, right, is occlusal inlays. Why do occlusal inlays? Because they bond the tooth together. They're easy to do. And they're much stronger for a person who's grinding. Because a person's probably going to grind some of those fillings out, especially if they're a heavy grinder. But with occlusal inlay, especially zirconium, they don't grind, they don't break down very easily. And so you basically do something better for the patient. You make a longer lasting restoration. And of course you get something out of it. So instead of $5 or $10 or whatever you get for your $30 for your filling, now you're doing an inlay and you're doing a much better service for the patient. Now, this is a brochure I use from Align Technology. For anybody who does Invisalign, this I give to every single patient who has periodontal disease. Every time I see a new patient and I go through, this shows you the signs of periodontal disease over here. So gingivitis, periodontitis, the whole bit, all the way through. Then it shows you grinding and it shows you abstraction lesions at the same time as it shows you what happens because the forces have to go somewhere. So it goes over here. And then it shows you the systemic part to it. So this is a summary of everything you've talked to them about. So even if they don't do the treatment, they have this summary here of how it relates to systemic disease. Wow, wow, you know what? Wow, my dad, wow, I have a heart problem there. My cholesterol's high, because you create C-reactive proteins, right? C-reactive proteins bind to the arteries. Arteries bind cholesterol. So without a C-reactive protein, which is created by bacteria in the mouth, you can't bind cholesterol. It just goes on its merry way. So a lot of things now show that the higher C-reactive proteins you have, even if you have lower cholesterol, you're probably in more danger of having problems than if you had high cholesterol and low C-reactive proteins, because any type of inflammatory response, any type of inflammation in the body creates C-reactive proteins, and they bind to the arteries. And that's basically, if one of the things they do, if you ever thought you have a heart attack or having problems, they sometimes test for C-reactive proteins. So that's a great brochure that I use, and I think it's wonderful for the patient. Okay. Well, what do you think that means?
Patients thinking they're going to have to break their piggy bank to pay for dental care.
That's a pretty good answer. Don't drill on wallets, drill on teeth. Don't go for the money. Do what's necessary and the money will come. Build it and they will come. Same thing. Okay, a couple little tricks here. What happens if somebody's in the waiting room and no one talks to them and no one responds to them and no one smiles at them? They do it their way. They're not going to come back to your practice no matter what you do. You've lost their trust in the waiting room before you even saw them. Now, I go out to the waiting room and I introduce myself. I say hi, but I also call patients the night before. I'm kind of that way. I've always been doing it. I call patients after to see how they're doing, and I call them the night before to introduce myself. And I'm like, hi, just Dr. Rosen, just wanted to introduce myself and kind of see, do you have any concerns or questions regarding tomorrow's appointment? And believe it or not, a lot of times they do. And right there, you're building trust. So when they come in and you go out and say, hi, I spoke to you last night. Oh yeah, that's right. No dentist ever really did that before. Well, now you build trust. So you've crossed that first trust bridge. And now it's easier for you because now they just go through the flow. Now, what happens if a person is in the chair for a very, very long time and no one responds? No one calls in, no one even, when they're walking by, no one sees how you're doing. Or you leave an impression in their mouth or a bite registration because you're running around and you forget about them. We all have done that. And all of a sudden, oops, oh my God, it's been about 10 minutes. I left the bite registration in their mouth. I got to go get it out. They remembered that experience and they'll tell 10 other people just from that one experience. So everything you've done with trust, everything you've tried to help them, synergy, all of that is now lost because no one paid attention to them when you're in a chair. Okay. Paul, why do you think I'm showing my dog here? That's my little guy. He's a rescue.
Is it you bring him as a therapy dog?
You could, sure. But how does it relate to practice? What do you think?
I'm not sure. This one's stumping me a little.
We practice on humans, not on animals. We can't
True.
practice on dogs. We can't practice on sharks. We can't practice on lions. It'd be kind of fun, actually. We have to practice on humans. It's a practice. Things go wrong. Sometimes things go wrong. But as long as we're honest, we can't all be perfect, right? We have to practice on humans. We have no choice.
I say, Dr. Rosen, nothing in my practice goes wrong. It just goes off script.
There you go.
Yeah.
It goes off script.
Yeah.
I like that. We need to be honest with our patients. If anything does not go the way we wanted it to or off script, Several root tips breaking, files separating, crowns coming off for some reason. Maybe we didn't do the occlusion, we didn't check the occlusion. Filling sometimes breaking. Sometimes we allow patients to convince us to do things, especially with dentures. They'll come in with like 4 dentures and you want to make them the perfect denture. And you find out, oh, well, wait a second here. Now this is the 5th denture. Okay, there are warning signs. So basically, look, you can't please everybody. You try, but sometimes you just can't. When I used to teach, you can't reach every student. You try. I've done everything I could to reach every student, but sometimes, they may have other things that are going on in their lives that they just can't concentrate at the time. So that basically, we just have to realize that. We should not show apprehension, fear, and anxiety in front of the patients. I had an associate who was doing extraction. She broke a root tip, and all of a sudden she started like bawling and in front of the patient, like, "Oh my God, I'm so sorry. I'm so sorry. I didn't mean to do this. I'm so sorry." I had to go in there and convince her that that nothing was done wrong. Let's figure out how to fix the problem. Things happen, but if I've also had EMS come because we've had anxiety attack or a panic attack, or someone had a grand mal seizure, or I had a patient who basically had a heart attack. That was like when I first got out of school. That was fun. But if you don't show apprehension and fear, the patient will relax. They're apprehensive already. So if you just show confidence, and your whole staff shows confidence, and we're trying to help them the best way we know how to, then basically they're going to have confidence in you and your staff. But once you start showing fear and anxiety in any way, they're going to pick up on that, because patients are very smart. They really do see through that. Okay. Teams have to be on the same page with the same terminology. Infection, saving bone, saving tooth structure. That's why we do composite fillings, because we're saving tooth structure. We don't have to do the old extension prevention with the old amalgam fillings, which eventually break, over time. We basically, take out limited tooth structure. That's an example. So I created a list actually for my team of the terminology I'd like to use in the office. And we try to stay on the same terminology. Because if one person hears one term and another person hears another term, they're not going to get that treatment done, right? Because now they're confused. So we all want to be on the same terminology. Infection goes a long way. If everyone says infection, that patient realizes they have an infection. They have to do something about that infection. If you're doing an implant over something else, why? You're saving bone, right? You're trying to save bone. That's why you use bone graft. You're trying to save bone. Because when you take out a tooth, what do you lose? 40% bone? I show them that on DSGP. I actually have it. And it shows you're losing bone. Okay. This I love. Success is an iceberg. Everybody thinks that dentists are so successful, or cardiologists, everyone's so successful. Okay, well, we are successful, but people don't see what goes on behind it. If you don't fail, how can you succeed? If you don't have setbacks, how can you learn? So next time you won't fail, or you won't go off course. Naysayers, doubts, hard work, more failures, sacrifices, risks, late nights, early mornings, courage, persistent in action. All of those things happen for success. So success can't happen unless you have all those things happening at the same time. It's kind of like an iceberg. You only see the top, but you don't see what's going on underneath it. These are two of my favorite quotes. Basically, life isn't about waiting for storms to pass. It's about learning to dance in the rain. I love that. And that sits in my office all the time. Because when I have those patients that come in that you just want to run and scream, I realize, you know what? I'm going to dance here. I'm going to dance in my mind. I'm just going to make this the best experience I can make it. And every day a new story begins. A lot of us go home and we think, what did we do today? Oh my God, what did I do? I can't believe I did this. I put a crown and I took a different angle. It was perfect when I put it in. I took a different angle. Now it looks like an open margin. What am I going to do? Finish each day and be fine with it. You have done what you could. Some blunders and absurdities have crept in. Forget them as soon as you can. Tomorrow's a new day. Begin it well. And serenity and with too high a spirit to be encumbered with your old nonsense. Ralph Waldo Emerson. Every day a new story begins. Forget about yesterday. Things happen. We practice. We do the best we can for our patients, but sometimes things go off script. And this is another one where basically Mother Teresa, and it just says all about life. Life is a blessing. Life is a challenge. Life is a duty. Life is a game. Life is a song. Life is luck. Life is life. Okay. We talked about some supplemental materials you can use in the operatory. This, if you look before and after, a lot of people will say, oh, well, you know, I have a little cavity. Well, look what happens with a little cavity. It explodes, right? So I love the Gross and Disgusting Totally Cool Mouth Book 1 and 2. And what that does, it shows before and afters, just like that. And it shows, and when you show a patient that, and you show them exactly why you need to do an inlay or a crown or whatever the case may be, that's a perfect example of before and after. Because they only see this, and they're like, oh, there's a little hole. Can you just fill that little hole? Well, not exactly. So DDSGP, I love that program. And again, it's an app. I think it's $2.99, I believe, and you don't pay anything else. It's yours for life. And it has every aspect of dentistry that you can show the patient, especially scaling and root planing. I mean, it's wonderful. ADH hair side, that's another one. Animated teeth, that's another site. YouTube videos, everything's on YouTube these days. I have a great video I share with patients that shows you how the bacteria or get into the bloodstream at a certain level, you know, and then basically they lie down C-reactive proteins, and that binds, you know, cholesterol, that whole bit. I have a great video that just shows just simply what periodontal disease is and how it relates to systemic disease. If I see the person has some sort of systemic disease in their medical history, I try to relate the two. I try to use analogies and see if I can link the two. That way they're more interested. Now they're active participant instead of a passive participant, because now they have something to gain. They have something to realize, you know what? Wow, I don't want to have a heart attack, or I don't want to have another heart attack. I better listen to this doc. You know, he has something, you know, he has something that I want to hear. So that's that. When your schedule is slow, okay, I answer phone calls when like, for example, if I'm sitting and I've got nothing going on, the phone's here in the office. If I see that they're on 2 phone calls at the same time, I'll answer the phone call. And I've actually scheduled patients, believe it or not, because when your schedule is slow, especially sometimes these days, it only takes one. Ever see the movie The Highlander? Great movie. It only takes one. It takes one phone call to make a day. It takes one patient having trust in you. It takes one huge case, or it just takes a friend of a friend, or, you know, coming in. It just takes one positive review to get somebody to come in. It takes that one phone call, like you just answer and say, you know what? Because if you don't answer, they're going to go to another dentist on their list. So the quicker you get to that, the quicker somebody gets to that, the more they're going to come to your office, and the more they're going to stay with you and not go down their list and go someplace else. So it only takes one. And I keep telling that to my staff. It only takes one. So for example, we had a day the other day where it was almost nothing on the schedule, and an emergency called. And I answered the phone, actually. And I handed up to the front after talking to them, introduced them to the office, etc. And we did a $7,000 day. And one patient. That's all it takes. And that patient told so many other patients and put a fantastic review on Google. And that's all it does. So basically, I hope people have learned from this something and take away something from this. And does anyone have any questions?
Dr. Rosen, I've listened to a lot of presentations in doing this, given a lot of presentations, and I really want to share that, you know, we have this recorded and we're going to create it. That really was just such a phenomenal, fundamental reminder for even people like me who've been dentisting for 19 years, but also what dentists should review at any age or stage. I compliment you on putting together something so easy to understand, but powerful on a topic that's tough. So questions, I have a few questions I want to ask, but if you're here on Zoom or on Facebook Live, feel free to ask one. You could stop sharing your screen. We could just be big for a second, 2 of us. So one of the things that I've gone back and forth with, kind of like, you know, I don't know if you're a golfer or play basketball. Sometimes people work on their shot. They try this way or another. giving the person the entire plan or just giving them a piece and telling them more later. So let's say you have someone, I did 6 consults yesterday. Majority, they need their teeth are ready to be removed and retire. I don't say fail, I say retire. So let's just say that it's an upper arch and it's going to be to remove the teeth, do bone preservation and short-term dentures. I don't say immediate, I say short-term, is $8,000. Let's just say it's $8,000. Then the overdenture, implant overdenture, snapping it out is going to be $15,000. We got 8 plus 15 is 23,000. Just share with me, it's more just curious how you roll out that pricing. Do you go with just the phase 1 and tell them more later? Do you tell them the whole thing? Share with me some of your insight on that.
Well, first, I would talk with the periodontalist. So basically, I have a periodontist come to the office, but I would have some kind of conversation with the periodontist and the patient. So we're all together on the same page. The second thing, well, but to explain to the patient, I would show them a model, and I would say, this is where we're going to go. And I would have to, in this case, you would have to tell them the stages. But you would say, you know what? We'll do the stage first. Let's get this done. We have to get something done first to start this, right? Otherwise, what's going to happen? Your bite's going to collapse, right? And then we're going to lose more bone. And then I'm not going to be able to do it. It's going to be more expensive. So let's start with this one aspect first. And this would be $3,000 or whatever it is, $2,000.
Yeah.
There we go over it with them. And then later, we would have to go to the other aspect and it will be more money. And at that point, you can tell them or not tell them. It all depends on how you want to deal with it. You have to feel out the patient. If the patient basically, if the patient thinks that, you think they're going to do it, then yeah, you tell them. But if you're going to scare them and make them really anxious, at that point, it may not be the greatest time to tell them that, just say, hey, let's start here. And then, and then we can work our way out, but it will be.
And the key I would share, I have some of my friends here in the chat. The awesome Matthew S. He said I could violate Zoom HIP. I can say his name out loud if I want. And he's credited some of our Nacho communication course with helping him. Also, just like when you miss that crown impression, you're going to miss communication things. You're going to tell someone a whole plan and they're going to run out. You're going to tell someone sometimes just one step and they say, why didn't you tell me earlier it was more? So you just got to keep testing instead of guessing your plan. And even me, 19 years into doing this, it's a challenge each day, but you got to just count the wins, and count the people that you do get to move forward. I will share, I've shared it numerous times. I think you'll love it. There's a great book called To Sell is Human by Daniel Pink. I have it on audio book. It's one of the best books I have ever listened to in my life on being a dentist, on being a parent, on running dental nachos, on literally getting people to move forward. And one of the things that he talks about, when I go on dental nachos and I say, do you have to be good at selling to be a dentist? A lot of dentists say, oh, you don't have to be good at selling. Doctors don't sell. And there's a whole chapter in the book about there are doctors who cannot convince people to get heart stents to save their lives when the heart stents are free to them. They have to pay nothing for these heart stents, $0. And they cannot get them to move forward. So it's a struggle that all of us have on creating impact. So I appreciate you sharing with that. I really like the part on terminology with your team. When do you find the time? I'm really curious to kind of review this. Do you do it in the moment? Do you do it at team meetings? Do you have them watch YouTube videos?
Team meeting. We have a team meeting every week, or if we're too busy, then we have a team meeting once a month. But usually we try to do one little staff meeting every week, just to go over what may have gone off course, or what are concerns of everyone. We have a huddle, of course, every morning, but just one quick team meeting. It only takes 15 minutes. Yeah. Maybe for lunch or something like that. And that's where I kind of present, hey, listen, here's a list of all the terms that we should use. I think it's important. Does anyone have any problems with this or any concerns? Because remember, your team is also working with you too. So it's not like you want to dictate everything to them. And a lot of people do that. Right. This is the way you're going to do it. Well, then they're not going to want to do it. But if you make them an active participant in it, saying, hey, what do you think of this list? What do you think of infection? You think we can use some? I like infection. What do you guys think? Yeah, that sounds good. Okay. Yeah. Now
you're sharing true nacho gold. Morgan, you can give me the host back because we'll end in a couple of minutes here. But we do the same thing, Mitchell, because it's just a little bit better each day makes a lot better dentisting life. We don't say fail. We say retire. No one's allowed to say fail. We say, Mrs. Smith, your teeth are ready to retire. And they laugh, right? So, just being on the same page with those words because they have energy. One of the things we talk about is people ask you a lot of weird questions. What's my insurance cover? Is this going to hurt? How long is it going to take? Our immediate response is, that's a really great question. I would want to know that too. The way it works here is your insurance is a coupon. So, they tell me, as we wrap up, and I know we have a lot of new dentists in here. We have some seasoned dentists. why don't they talk about this more in dental school? Or like, why can't we get this back to the people who really need it instead of learning this by trial and error? People say learn by trial and error, Mitchell, that's a very annoying way to learn, right? It would be great if people just said, here's I have this book that I have here all the time, the Checklist Manifesto. And if people read this book, their life is going to be better, right? So just this tip, read this book, listen to this book as a dentist. So you don't need to learn through trial and error. Atul Gawande put it all together. So why don't you think dental schools talk more about this?
I don't know. Why do you think I did a handshake for my first practice? And then at the end, I found out I'm not going to be a partner. I mean, it's like they don't understand that, a lot of this is just, it's common sense, but it's not.
Yeah.
And I wish they did teach this, because they're so concerned about didactics that they don't really understand, what we really need when we get out.
And I have this guy here that I talk about to prevent crying on the inside and outside. Your dental core is your words, your mind, your hand skills, and your heart skills. For some reason, they spend 90% of the time on how to prep a crown and 0% of the time on how to read a P&L or talk to patients. When you're playing this game of dentisting basketball, it's all of it. I mean, you're a practice owner, I'm a practice owner. You got to know how to talk about money, how to do an implant impression, how to, manage your expenses. And it just drives me nacho nuts that they don't have people like you sharing something like this with them.
Well, thank you. That's why I've been doing this to schools. I've actually presented a number of different schools. I do it for free. I never get paid for it either. I like doing it because I see after I finish, people are just like, wow, it's kind of it's like an eye opener. It's really
it really does it. Morgan, make sure you drop the CE code in the chat. So if you're here watching, you earn live CE on TV. If you're watching on demand, there's going to be a quiz that you fill out, but Morgan put the registration link in there, but there's also the code, Morgan, that you can pop in there for the group. That's what they enter. Perfect. So take a screenshot of that. Well, Mitchell, I hope we get to meet in person. You got to come to Philadelphia. I got to start my, I have a Nacho Ambassador program that I'm starting, which is great. We talk with dental students and young dentists and, get them to share Nacho stuff and learn. So we're going to start that in a minute, but really appreciate your time tonight. I know time is our most valuable commodity, and I really appreciate you sharing it with us.
Well, I love mentoring. I love doing that kind of stuff too. I mean, that's what I do. I mean, I like it because I've been in situations where, I've got in trouble or not trouble when, of course, and then, and no one was around to help me, and nobody was around to talk to me. And, and that's why I mentor, and that's why I still mentor. And that's why I learn every day. And I help people who are veterans and not, and then I also sometimes treat military on the weekends. I used to before COVID.
That's really awesome. So we're going to jump off, but come to Philly and visit us in person. Morgan Bellis will make sure she kindly annoys you about our courses. Thanks everybody for watching, and have a great evening, Mitchell.
Thank you, guys.
You did a great job.
Happy holidays.
Happy holidays. Thank you.